Despite hopes for the first vaccine approval in the coming weeks, the Centers for Disease Control and Prevention still has dire predictions ahead. Michael George reports.
COVID cases are reaching unprecedented numbers. Wednesday, the U.S. recorded the single deadliest day since the pandemic began, with more than 3,100 American deaths. Pressure is growing for the FDA to approve a vaccine candidate. Operation Warp Speed hopes to have the Pfizer vaccine out the door by December 15th, once it's approved, with doses allocated to states by population. Dr. Anthony Fauci is critical of British regulators he feels rushed to approve a vaccine.
If we had jumped over the hurdle here quickly and inappropriately, I think that the credibility of our regulatory process would have been damaged.
On the CBS News podcast, The Takeout, the nation's top infectious disease expert said it will take a community effort to get Americans immunized.
We've got a job to do to reach out and convince people to get vaccinated.
Here in New York City, the mayor says average daily cases of the virus are reaching levels not seen since the worst days of the pandemic in April, and hospitals are quickly filling up.
It's really important for folks who have gone through so much, who are understandably feeling fatigued, to see that there is light at the end of the tunnel.
The surge nationwide prompted Los Angeles Mayor Eric Garcetti to impose tighter stay-at-home restrictions and a 3-week ban on in-person dining with some exemptions.
It's time to cancel everything. And if it isn't essential, don't do it.
Massachusetts Governor Charlie Baker visited a field hospital in his state designed to help alleviate pressure on medical facilities.
People need to stay vigilant, and they need to keep doing the things that we know keep the virus in check.
The head of the CDC, Dr. Robert Redfield, said the next few months could be the most difficult in the pandemic without more precautions taken. Michael George, CBS News, New York.
Politico healthcare reporter Dan Diamond joins me now with more. He's the co-author of the Politico Pulse newsletter. Dan, welcome. Good to see you again. I want to start with Dr. Anthony Fauci, the government's top infectious disease expert. In an interview with our Major Garrett this morning, Fauci confirmed that he plans to stay in his role in the next administration. I want to play a longer clip from him on why the UK approved an American and German-made vaccine before the U.S. government did. Let's listen.
So I promised a conversation about vaccines. Let me just get some basic things on the table. Why are the Brits first?
You know, in all fairness to so many of my UK friends, you know, they kind of ran around the corner of the marathon and joined it in the last mile. I think that would be a good metaphor for it, Major, because they really rushed through that approval. The FDA, the United States of America Food and Drug Administration, is the gold standard of regulation. They're doing it in a very careful way, appropriately, because if we did anything that was cutting corners and rushing, we have enough problem with people being skeptical about taking a vaccine anyway. You know, I love the Brits. They're great. They're good scientists. But they just took the data from the Pfizer company, and instead of scrutinizing it really, really carefully, they said, okay, let's approve it. That's it. And they went with it. In fact,
a late October poll from Gallup shows about 4 in 10 Americans still would not agree to get a COVID-19 vaccine. Dan, what's being done to try to win them over?
Well, I think, Elaine, there are reasons that we got to this point. The process that Dr. Fauci was discussing, Operation Warp Speed, did get politicized. President Trump did seem to put his finger on the scale by talking about how the vaccine needed to be rushed. So there are people who might support the idea of vaccines, but feel that this one may have a political stamp when it doesn't. So to address that, I think there are going to be a combination of private sector and public government efforts to really educate people about the need for COVID vaccines. We reported yesterday on a new group funded by Pfizer, which is making one of these vaccines. They're trying to boost vaccine awareness and uptake in vulnerable communities. They're working with, I think, about 60, 65 groups around the country. And last week, we reported on the Ad Council. They're an industry consortium. They work on ads across the US on public service campaigns. Folks who may have watched TV in the 90s and the 2000s could remember the Smokey the Bear campaign or the Friends Don't Let Friends Drive Drunk campaign. That was the Ad Council. So they're working on a campaign too. And the federal government does have hundreds of millions of dollars set aside for an ad campaign that didn't get off the ground. We reported on it. Some other outlets dug in too. It seemed to be getting very politicized. There were efforts to get celebrities to potentially say things positive about the president. So that campaign got put on pause, but there's still money in the bank that could be tapped to run more ads to boost awareness of the vaccine.
So, let's talk about the reality, though. If in the initial days of vaccine approval, it won't necessarily even matter if people want to get the vaccine because there's going to be such limited supply. For example, the Minneapolis-St. Paul area has been told that they will only get 1/3 of the doses that their frontline healthcare workers need. On top of that, the Wall Street Journal reports that Pfizer expects to ship just half as many vaccines as they originally planned because of supply chain issues. So, Dan, what are you learning? How gradual of a process will this rollout actually be?
Well, Elaine, it feels like the kind of process that might start slow. It could still ramp up in a hurry, but the goal is to vaccinate the elderly and healthcare workers first, the most vulnerable elderly and long-term care facilities. The CDC had a key advisory committee this week recommend that the population of health workers, which is about 20 million, 21 million people work in the healthcare field, and then the 3 million or so people who live in long-term care facilities, they should be at the front of the line. And even getting them all covered by the end of December based on the vaccine availability is probably not going to happen, but it could be close. And the reasons to put them at the front of the line, there are about 250,000 health workers who have gotten sick with COVID since the start of the outbreak in the US. And about, I think 40% of the deaths from COVID have occurred in long-term care facilities, either from staff or residents. So that's why they got moved to the front of the line. But there are other groups that are teed up to be next. Essential workers, which could include firefighters, police, teachers, people working in meat processing plants, and then other adults who are 65 and older could come next. Someone like me probably will not get the vaccine until well into 2021.
Meantime, Dan, Politico has some new reporting on who President-elect Biden is bringing in for his COVID-19 response team. What can you tell us?
Jeff Zients is set to be the COVID czar for President-elect Biden. If that name is familiar, it's because Zients was the guy tapped to help fix healthcare.gov, the Obamacare sign-up website, after it stumbled out of the gate in 2013. So the thinking is that this is another fix-it job. He's not a doctor. He's a fixer. He's a management consultant. I should also say, Elaine, full disclosure, he was the CEO of the company where I had my first job out of college, though we only had one notable interaction when he said that my name sounded like the name of a professional wrestler. Meanwhile, Vivek Murthy,
Okay.
it's true, it really happened. Vivek Murthy will be returning to his role as Surgeon General. He didn't get to serve his full term under President Obama, who nominated him. There was a long fight in Congress because Dr. Murthy had opposed wide accessibility of guns. He said that it was a public health crisis. One reason we think he is not going to be the HHS secretary is because it would likely be a big confirmation battle to get him through to that job. He'll still likely face a battle to be Surgeon General, but he would be a souped-up Surgeon General. He really has the ear of President-elect Biden. And then a professor from Yale who's been advising the Biden transition and campaign, Professor Nunez Smith. She is someone who has specialized in healthcare disparities. She's also someone who would bring diversity to the healthcare operation at HHS. She's expected to get a senior role where she would really deal with issues related to communities of color, which have been so hard hit during this pandemic.
Well, we're still waiting to see who President-elect Biden will choose for his Health and Human Services Secretary after his reported top pick unexpectedly withdrew from contention this afternoon. Do we know why, Dan?
So this has been a really messy process. And the top contender that you mentioned, the Rhode Island governor, Raimondo, she said not interested in taking a cabinet position. She was someone that had moved, per my colleagues reporting, to the front of the line based on her mix of management experience, someone who had addressed COVID in a way that was seen as generally responsible. And to be a cabinet secretary, especially in the middle of a pandemic, the Biden team really is looking for people who have management experience, healthcare background. It is a management job overwhelmingly. She was immediately condemned, though, by progressive groups as being too restrictive on either social services. She has a background in the finance industry. So those were targets for the progressive wing of the party. And within a day of that report, she is no longer in the mix. But yeah, there's a real question about who wants to run HHS. Elaine, it could be you. I mean, the challenge has been for the Biden team finding someone who wants this job, which is a little surprising to me as a health reporter. This is a very important job at a very important time in our public health history.
Yeah, it is a daunting challenge for whoever it is that ultimately gets tapped for that position. But Dan Diamond, you'll let us know on another note whether or not you get that exclusive because of your name. Dan Diamond for us.
I'm crossing my fingers. We'll see.
Okay. Dan Diamond, always great to see you. Thank you so much.
Thank you.